Happy Wednesday, everyone. This is Kristen Maka with Futurity First Insurance Group, and welcome to Kristen's Nuggets of Knowledge. This week has been fabulous weather in Omaha, Nebraska, and I hope wherever you're at, the weather has been just as spectacular. Today's topic that we are going to cover is Medicare, and we are joining forces with Mr. T, and we're going to be talking about Medicare Part A. Now, there are 5 different parts to Medicare, and these 5 different parts cover 5 different services. So it is very understandable that individuals get very confused with Medicare. But as long as you know these basic 5 parts of Medicare, and I have some great tips on how to remember what they are and what they cover, it makes everything so much simpler. And you already have in your wallet a very good cheat sheet right here. Original Medicare. Our Part A is our hospital and Part B is our medical. Now, if you remember my history lesson on Original Medicare and how it came about, I talked about when there was a time the government allowed individuals to get their Medicare insurance through private insurers. And because it was their choice to do so, they called it Medicare Part C. Now, those insurances still exist, but they are now called Advantage plans. Next up, we have Medicare Part D, and that is for drugs. So that would be your prescription drug coverage. And lastly, because not everything is covered under Original Medicare, the insurance companies wanted to make sure people were insured against the gaps and the holes within Original Medicare, and so therefore came out with Medicare Supplement or Medigap policies. So when we're looking at the different parts, here's a very brief list and 10,000-foot overview of the different parts of Medicare. And today we will be discussing Part A and what it entails. Are you ready to go grab some nuggets of knowledge? I know I am. Let's go, shall we? The list of items that Original Medicare Part A covers is relatively short, that we can accomplish getting through all of those parts, as well as an in-depth view on each of those parts in a short video. So when we're looking at the overview, general overview of what all Medicare Part A covers, is it covers inpatient hospital care as it's associated with the hospital, as it's associated with a religious non-medical institution, as well as a skilled nursing facility. Now, please don't get that confused with custodial care or long-term care. That's completely separate and is not covered at all by Medicare. But our skilled nursing facility is. Next up, Part A will cover blood, as well as hospice care and home health care. So that's the general overview of what Original Medicare Part A covers. Now let's work our way back up the list and go into depth on what these different items entail. All right, let's go into detail and work our way back up that list. So firstly, we have home health care. This is when a doctor has said, hey, it's probably best that you receive your care in your home. So part-time, a nurse will come to see you, make sure everything's okay, give you whatever prescriptions that you may need. In this instance, your care is totally taken care of by Original Medicare Part A. The only thing that it doesn't cover is durable medical equipment. And you are on the hook for 20% of the Medicare approved amount for whatever medical equipment that you need. Hospice care is next up. And that is when we have been deemed terminally ill or have 6 months or less to live. And with hospice care, we agree to just be taken care of to be as comfortable as possible before our passing. And in that instance, as long as we are within our home, and basically 95% of hospice care is done within the home, there's only a few instances where it is not. And if you're one of those instances, you are on the hook for 5% of the Medicare approved amount of the care that you receive in that inpatient hospice care. Other than that, hospice care is taken care of aside from the prescriptions that you will be needing to help keep you comfortable. Next up, we have the blood. Now, the blood, as long as it is donated to the hospital or by, somebody within your family, it is on the house. If it is not donated and the hospital has to purchase it, you have to cover the cost of 3 units of blood before original Medicare Part A covers everything else after that. Next up, we have our inpatient section. So remember those 3 different spots that were considered inpatient. Now, whether you're inpatient or outpatient, that is determined by your doctor. So you're going to want to know how you're being treated. Now, Part A will only cover inpatient and Part B will cover your outpatient. So how do you remember if it is covered under Part A or Part B, in or out? I don't know. Well, I have a very simple trick to help you remember. We've got the letters A and B here. So the letter A looks like a roof, just like that. And we are covered underneath that roof. So that is our inpatient. And with original Medicare Part A, it's covering everything within that building. Okay, so your room, your board, your food, nurses, prescriptions. So everything within that facility, aside from doctors that are specific to your case, but like I said, the nurses, the staff, everything that's included within that Medicare Part A. In your Part B, I always think it as you're going in and out of the facility, okay? So that is where your outpatient care comes in play. When we're looking at those different places that Medicare Part A covers us as an inpatient, we've got religious, non-medical, and everything is taken care of through Medicare Part A as far as that is concerned, because basically it just boils down to room and board. Next up, we have our skilled nursing facility. Now, as I said, to remember not to get it mixed up with custodial care. So in skilled nursing facility, Medicare Part A will cover days 1 through 20. That is on the house. Day 21 through 100, though, there is a coinsurance that is particular to your instance. And after that, unfortunately, you're on the hook for 100% of your coverage after day 100. Last but certainly not least is hospital inpatient care. So as I said previously, everything as it's associated with inpatient care has to do with the nurses that are in staff, the medicine that's there, your room, your board, your food, the equipment that they need, everything, all the supplies. Just does not include your doctors or your specialists that are seeing you. So in the hospital instance, what you are on the hook for as far as costs go is you have a deductible that you need to fulfill before the Part A insurance will kick in. And that deductible does change every year. This year in 2020, it is $1,408 that you need to suffice before the Medicare insurance will kick into place. And that is from day 1 to day 60. After that, from day 61 to day 90, there is a co-insurance per day that you have to suffice if you're in the hospital for that much longer. That co-insurance is $352 a day. Now, for any day after day 90, you are on the hook for 100% of those costs. There is one little extra help that Medicare gives you. If you've surpassed those 90 days, they want to give you what they call lifetime reserve days. So you have 60 lifetime reserve days of your lifetime that if you were to surpass those 90 days, this would kick in. Now, obviously, it's going to be a lot higher than what your co-insurance was previous in that day 61 through 90. and it is $704, but at least it's not the full amount. But you do only get 60 of those days a lifetime. So this is why, now granted, as I said, Medicare Part A does cover a lot, and it does help out a lot to cover the costs if you did not have it. However, there are significant gaps, and that's why a lot of people do either look at having their Medicare C, their choice, or their Advantage plan, or they look at getting a Medicare Gap or Medicare Supplement policy put in place to cover for all of those deductibles, co-insurance, co-pays, 20%, 5% that they would have otherwise had to have taken care of. I know we covered a lot, but hopefully I made it simple enough to follow. Just keep in mind and remember that Medicare Part A covers everything that's associated underneath and within as an inpatient care for the hospital. That's the main thing that you need to remember. It does cover other things, but that's one of the main key points. So I would like to thank you for tuning in today. If this was of use to you or you found the information exciting, please give me a thumbs up. I would appreciate it. And please have a wonderful and blessed rest of your week. Enjoy the sunshine wherever you are at, if it is out and sunny. Other than that, I will see you next week. Take care.